जमाने में ओवरहेड प्रोजेक्टर से पढ़ा जाता था। एक युग में हमारे पावर पॉइंट आया, अब आर्टिफिशियल इंटेलिजेंस भी आ गई, और साथ में कई रिसर्च पेपर्स हुए जिसमें ये पाया गया कि हमारा वीडियो ज्यादा बेटर है पावर पॉइंट से। मैं आप सभी का इंडिपेंडेंट रिसर्च एथिक्स सोसाइटी की आयुष समृद्धि ज्ञान गंगा के 1996वें पड़ाव पर पुनः स्वागत करता हूं। शॉर्ट फिल्म्स फॉर हेल्थ अवेयरनेस। आज सबसे बड़ी जरूरत है कि हम आयुर्वेद के लिए, आयुष के लिए, योग के लिए तो बहुत सारे वीडियो बन गए हैं। आयुर्वेद के सिद्धांतों को समझाने के लिए छोटे छोटे वीडियो, एनिमेशन वगैरह इतने यूजफुल होंगे कि जिसकी कल्पना नहीं है। मैं आदरणीय डॉक्टर विष्णु प्रसाद शर्मा जी को स्वागत प्रवचन के लिए सादर आमंत्रित करता
Namaskar. Good evening to everybody. Hari Om. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to AYUSH SAMRIDDHI International webinar series on short films for health awareness. Most important subject today we have. In this webinar, we have eminent speaker. I want to welcome Dr. Suparna S. Mukherjee from Bolpur. Namaskar, madam, and welcome you to Ayush Samriddhi International Webinar Series. Next, I want to welcome Dr. Soikat Kumar Basu from Alberta, Canada. Namaskar, sir, and welcome you to this Ayush Samriddhi International Webinar Series. Once again, I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, सबको आयुष समृद्धि इंटरनेशनल वेबिनार सीरीज ऑन शॉर्ट फिल्म्स फॉर हेल्थ अवेयरनेस सबको स्वागत करते हो। वंस अगेन आई वेलकम ऑल ऑफ यू। थैंक यू। नमस्कार। ओवर टू पवन जी।
बहुत बहुत आभार सर, आपका बहुत बहुत आभार। मैं आदरणीय अग्निहोत्री सर से प्रार्थना करता हूं कि वो अपने प्रारंभिक उद्बोधन सहित मंच संचालन, हमारे साथ दो वक्ता हैं आदरणीय शेखर जी और सुपर्णा जी। तो अब मैं अग्निहोत्री सर, प्रणाम सर।
धन्यवाद सर, बहुत बहुत प्रणाम। धन्यवाद। हम अपने आज के इस वेबिनार के अतिथि वक्ताओं का भी बहुत इस मंच पर स्वागत करते हैं। और बड़ा अच्छा आपने बताया कि शॉर्ट फिल्म एक जीवंतता प्रदान करती है, इट्स वाइटैलिटी एंड मूविंग इफेक्ट, डायरेक्ट इंप्रेशन देती है हमारे मस्तिष्क को कि हम जो देख पा रहे हैं वो सुनने की तुलना में अधिक प्रभावशाली होती है। और मुझे अच्छे से याद आ रहा है अपने इसी प्लेटफॉर्म से हमारी आदरणीय डॉक्टर सुपर्णा सानन मुखर्जी जी और शेखर जी ने अपने ग्रुप वाले सेक्शन में वो जो शॉर्ट फिल्म भेजी थी, इसकी उन्होंने यहाँ चर्चा की थी। इसका कलकत्ता से वो उद्घाटन हुआ था। छोटी फिल्म है लेकिन बड़ा मैसेज कन्वे करती है। तो ऐसे बहुत सारे छोटे छोटे वीडियोस जो हमारे एकेडमिक नेचर के इंटरेस्ट के होते हैं और बहुत सारी पक्षियों को बेस्ड है, बहुत से रेयर प्रजातियों पर हैं। ये जो मतलब दुर्लभ प्रजातियां जो अब एंडेंजर्ड हैं, उन सब के बारे में छोटी छोटी चीजें वो बहुत अच्छे से आती हैं। और जैसे अभी उस दिन मोपल सिरप की बात आई या हनी बी की बात आई, जो दूर में है, हम डायरेक्ट इनको नहीं देख पाते हैं, उनके एक छोटे वीडियो के माध्यम से एक बहुत बड़ा मैसेज, एक बहुत बड़ी नॉलेज हम लोगों को कन्वे होती है। तो इसलिए उनको हम निश्चित रूप से बहुत अधिक सुनना पसंद करेंगे और उनसे जो हमें गाइडलाइंस मिलेगी, जो मोटिवेशन मिलेगा, मार्गदर्शन मिलेगा, उससे हमको और हमारे प्लेटफॉर्म को बहुत लाभ पहुंचेगा। इसी शब्दों के साथ में मैं क्रम के अनुसार पहले मैडम डॉक्टर सुपर्णा सान्याल मुखर्जी जी को बहुत ही रिस्पेक्टफुली इनवाइट करता हूं। उनका बहुत बहुत स्वागत है और उनसे मैं प्रार्थना है कि वो अपनी प्रेजेंटेशन देने की कृपा करें। नमस्ते मैडम। नमस्कार मैम। डॉक्टर सुपर्णा सान्याल मुखर्जी जी, नमस्ते।
Namaste. Very good evening to all the dignitaries over here. Many thanks to you all, and Sharma ji, Agnihotri ji, and other dignitaries. I really convey my best regards and gratitude to giving me such an opportunity to say on this short films and health awareness of the Ayush especially. Now the time has come to explore the Ayush with the very little short film if we can generate the awareness. So why this short film? Short film is very important part of our uh, recent time, just because we all are busy in our work. We don't have any time to spend to view the movie like 3 hours, and the movies, especially commercial movies, business oriented movies, the other types of movies, documentary, so many things, but we don't have such time to observe it or to see the movie, the long movies. Hence we have the now the micro evolution is going on, and this micro evolution time we can spend our time like 20 minutes or 30 minutes we can spend to watch this movie, and we must have the tolerance time to observe it. Hence, the short film and short movie is very important nowadays, and it is exploring each and every parts and each and every sector of the of our society. The health awareness, especially the Ayush platform and short film on the Ayush program, is very important. So we can send the message, and we can explore, and this short film can explore the Ayush materials more popular in the community at large, because there are so many communities, though the facilities are there, the people are residing in the surrounding areas, so they don't know the uses of this, especially the medicinal plants, biodiversity, and then which plants is more effective for us. This will be the very important fact. The people should know, the community, those the people, those don't have any kinds of idea regarding it, they can be explored and they can acquire the knowledge. The tribal area or the aboriginals, those who are practicing the medicinal practice, and those who know the what type of roots and what type of leaves and are needed for the medicinal aspects, so they have the indigenous knowledge by themselves. So in that cases, it is very powerful for storytelling, and this powerful positive messaging, and set the take care of the part of the health awareness, and it may develop the health programs and awareness generation among the people, those who are not being known by themselves. So there are several movies, short films has made on the particular name, like the I Choose Patience. This I Choose Patience, if we can see it, the if when the a woman, the storytelling, the story is exploring on the patience of a person, the woman, how they have overcome their problems and the such kinds of diseases they have overcome, and they can explore, and they are surviving in the nature. So this movie has been explored by this these short movies. Then the peer healing, it is also the praying movement, how the pray is effective, and how the heal and touching process, and the medicinal effects which has been cured several types of diseases, it has been explored over there. Then imagine embracing morality. So this picture will give you the a total ideological point of view, that how a patient can develop and they can recover from the various chronic diseases, and they can get the treatment through Ayurvedic, and they develop their sustainability and the life sustenance. And my wake up call. So it is also based on the diabetic, so how the diabetic patients can recover. And this short film has explored the what is the effect of the meditation, what is the effect of the how the meditation is affecting this diabetic patient. And without the patient, when they are insulin has been incorporated, and from this insulin part they have recovered and they are getting the normal life. It is the process they have been explored through this movie. And another one thing is healing through harmony. Healing through harmony. So there are several processes, the health awareness system. So if we can make the positivism, and if we can develop the harmony in the human mind and human soul, then we can live a better life, and life very expectancy can be developed. And another one most important movie is the Walking in Gratitude. That is a very good movie which can develop your how when you have been recovered or when have been good for your health. So how you can develop your gratitude for this suffering on these diseases, where how you have suffered, and when we are not suffering, so you can reestablish yourself from the recovering. So these types of movies are very important, and short films is giving you the knowledge. Short film can giving you the idea. It is an awareness process. They can develop your sustainability, your cognitive senses, and your knowledge through of the particular diseases, and which you don't know the what is the uses of the medicines, what you have to do. So that only you can develop through this short film. And short film have a very wider aspects and very wider socio-cultural, socio-political, and socio-economic, socio-religious aspect, which is being developed by this short film, and which can recover various types of diseases. And each and every disease can you can go through the chronological aspects, because you can make it the three-dimensional aspects, like the you can make it how the allopathic can recover it, how the homeopathic can recover it, and how the Ayurveda can recover it. Because the people those don't have the any ideological point of view of Ayurveda, they can develop their senses of Ayurvedic treatment and Ayurveda, how the Ayurvedic is very important for that. Because there are so many chronic diseases which has not yet been cured by this allopathic treatment. But it is needed, the Ayurvedic, the long-term process, though it is a long-term process, but gradually it can recover, and it can recover through the root portion. So that's why the short film can encourage, short film can develop, short film can giving you the knowledge, courage, and the sustainability. So that's why the short film movie is very important, especially for the Ayush treatment and Ayurvedic exploration. Thank you very much. Thanks for giving me such an opportunity. Thanks a lot.
Thank you, madam. Very pinpointed and concise presentation, commenting upon the topic short films, and that too how much it will be useful in the field of Ayush. Definitely, Ayush education, treatment, research. We have got number of sectors where it is needed. So your presentation, your guidelines towards this direction will go a long way in the purpose of utilizing, making a use of these short films. Contribution towards our Ayush system. Thank you so much. Now, I would like to invite respectfully our beloved Dr. Shekhar Kumar Basuji for his presentation and his comments and guidelines towards the short films concept and how it may be helpful for the health purposes, health awareness, and also in reference to the Ayurvedic science or Ayush development. Dr. Shekhar Kumarji, namaskar.
Namaskar, namaskar. Thank you, Sharmaji, Agnihotri ji, and Adarsh Sharmaji. It is a pleasure once again. I thought we would not be able to make it today, but finally we got a good connectivity at the guest house that I am here.
Thank
So
you so
I
much.
got I got the connectivity, so I'm glad that I am here. So thank you very much once again for inviting me, and I also extend my sincere gratitude to Madam for giving a nice outline. I will highlight a few important points that further adds to the important suggestions and other important points that she has raised. So first of all, not just health sciences. Short movies now have a very significant impact on all forms of educational aspect in every discipline, whether it is science, whether it is humanities, whether it is social sciences, medical science, agricultural science. In every discipline, such short films have very significant impact. Just getting back to medicine in particular, you would see that now many surgery movies are available, like which not only helps the students to learn about surgery and anatomy better, but it also gets very closely integrated into the system that they are studying. How this is working? This is like, say, for example, surgery, or for example, anatomical dissections and stuff. We know that we have a dearth of shortage of human bodies and stuff. Students pile around the professors while he or she is making the dissection, and they are watching it to the best of their ability, but not always they have the ability to look into the depths of the dissection, because our student load is high per professor, and it is not easy for to get a three-dimensional view of the proper dissection, and also to get an opportunity to learn it. But then again, you have to appear in exam. 10 years back, it was not easily accessible and available for students. So you have to look into books, you have to study journals, you have to see photographs, either artistic expression or medical photographs, to get an idea about this dissection, where to touch in your knife and where to touch in your scissors and stuff and things like that. But now, if you look into the internet, even for general public, various live demonstrations of surgeries in various disciplines are available. I mean, some of them are long, but there are around, they vary from 15 minutes to 45 to 1.5 hours to 2 hours. Particularly for people in their different disciplines, they get a very good idea of various kinds of dissection. There are 3D animations of where these operations are being operated, how to handle this. Every single details in super surgery cases also are being made available. If you go into Western universities, such animation movies have made surgery like a virtual training process. Just like pilots, they always do not get chances, or like cosmonauts, they always do not get chances to practice on real life scenario, or real life spaceships, or real life aircrafts, to always get used to the various gadgets they have to use while they're flying. So a flight simulation mode or a cosmonaut simulation modes now are available, where 3D interactive videos and your hot seats, everything is available for training them extensively, so that when they are landing into the real spaceship, or when they are really running into the aircraft, they feel more comfortable. So such surgery short movies are extensively available nowadays, which helps. And even there are various companies, medical three-dimensional product or cartoon using companies. There are fabulous productions. They are available in many libraries for the students to go and watch them. And these gives them a perspective of a total three-dimensional view. They use X-ray patterns, MRI imagings, and so on, depending on what kind of surgery that you are looking for, even for general anatomy and studies. I have seen that various autopsies or medical class anatomy training and stuff, showing various parts of liver, bone identification, and all these details are now available in various YouTubes. There are Indian videos too, and there are videos from various other countries from their classes, where you can see the lectures, where you can see how the various body parts look like, various angles, various modifications, where to touch your instruments in the ER command room. So this has, I think, revolutionized the medical sciences for making it easily accessible to students who outside the class, if they need help, have now plenty of resources. These are random YouTube's videos that I'm talking about, but in specific medical colleges, and particularly in Western countries, there are series. Like, say, for example, if you are looking for kidney transplants, there are hundreds and thousands hours of video production. Various doctors, various surgeons who have worked on various aspects of this surgery have made beautiful videos, and they are available in their university. You can log on and spend countless time on a one-on-one computer, on your personal screen, on your laptop, on your tab, so that you can go through and see how these surgery procedures are done from the start to the end, whether it is anesthesia, whether it is gynecology, whether it is ENT, every single discipline that you can think about now is available, demonstration and stuff. And I'm saying that this is just not restricted to medical sciences. This is now available in various disciplines, whether it is geology, whether it is biology, like even for biology dissections, right? These days, we used to dissect frogs. We used to dissect toads for various of our biology classes, but these also takes out very rare species from our environment. So now there are very much, what you call three dimensionals surgery procedures and stuff that shows dissection of animals and stuff. So you can get to see very much details of those animals that you need to learn from the classes for your zoology and other practices. Makes it very easy, and you can even see it even better than what you would do even in your dissection table. They provide a longitudinal sections, cross sections, how artery veins are operating and things like that. Everything comes in front of your eyes, like, with blink of a few options of clicking something, and next opportunities. I have even come across many beautiful human body animation movies where you have interactive buttons. So you stretch the whole, you have the whole body, you stretch the bones, it shows the entire bony structure within the body. You want to have the bone and the muscle together, you can see the bone and muscle together. You want to have the only the pulmonary artery system highlighted, a specific color shows up, and it shows the connection of the pulmonary artery, and even the flow and the circulation, how which side is followed, which side is there, and every intricate details of surgery, and more with more advancement, with more information technology advancement, AI technologies and other gadgets that are making things available. This in this virtual reality, a doctor gets, if he's serious and wants to learn the process, there are innumerable ways and stuff to get practice, get used to the sections and stuff. So for example, one has a particular hesitation, well, whether I should, when I'm touching the scissor, whether I'm going to touch this nerve or I'm going to leave that nerve and stuff. So there are real-time pictures as well as scanned images and stuff, cross-section, tomography, everything being provided. Like what principal doctor or principal investigator would get results from various sources, everything is now available in such movies. Even lectures from various premier institutes. I have seen this in, whether it is arts, humanities, social science, medical science, agricultural sciences. Harvard School of Medical Sciences have outstanding lectures in various aspects of medical sciences, or a particular surgery, or a particular technique, or a particular method. Series of such lectures are now posted on the internet. So even if you are not studying in Harvard, if you want to spend time, there are countless resources available where you can go and look into the lectures of legendary professors who have specialized on a particular technique they are talking about. I have seen the various transgender operations, male to female, female to male operations, live demonstration on YouTube versions and stuff. If for non-medical persons, when you see blood and stuff coming out and surgery being done and stuff, it gives an eerie feeling. But for a medical student who are used to this, I think this gives you a hundred and thousands of hours of practice. So you get accustomed to the, like, which part to touch, which part to avoid, which vein to avoid, which artery to avoid, which artery to include and stuff. In every disciplines of medical sciences, these are getting available. With more days, more such videos are being loaded. So I significantly believe that these have very much impacted medical education. This has also impacted other branches of science and technology too, where you get to see all these kinds of, for example, in molecular biology, we do so much of this DNA running, gel running, protein loading and stuff. So these are skilly techniques that you need to do a lot of practice and stuff. But there are easy demonstration for the class students, like even with animation of what is to be mixed with what is the chemistry behind that. So if you want to really spend good time on the net, dedicated to a particular science and a subject, extensive literature materials are available. One could not have enough time in his lifetime to go through so many of these videos. And the libraries are these days packed with this stuff. How much the modern librarians in India are aware of that and how much they are educating their students about that, that may be a different question, but it is available. Even if you are just inquisitive, if you go and look and put in the search of various kind of surgeries, anatomical classes, anatomical dissection of the human body, male and identification, forensic sciences, physiology and stuff, everything is available. So this has very much enriched, I sincerely believe, medical sciences, where students who do not get enough time in their laboratory classes or dissections and stuff can still upgrade themselves, increase their confidence by looking into their details. So these are significant impact. Furthermore, the one other important aspect is medical ethics. Many times students who are going through this process may not have a proper idea of whether we are working at the boundary of the medical ethics. What is medical ethics in these particular cases? What should you do? What are the best practices and stuff? I do not see much of Indian content material on that, but if you look into medical ethics videos and stuff, there are outstanding videos where people are acting out. So they're bringing a patient that has a particular problem, some kind of challenges you have done, and the doctor makes a mistake, and then there are corrections like these are the things that you should do, these are the things you should avoid, these are the comments that a doctor can make, these are the comments the doctor should never make, you should never make this claim and stuff in front of the patient party and things like that, or this is legal, that is illegal. And these are done through various short clips and movies, like with real life examples. There are actors who are acting out as patients and doctors and surgeons, but it gives such a beautiful idea about medical ethics and what you should do and what you should do not, what is beyond the prospect of medical ethics and what is within the prospect of medical ethics. These are beautifully acted out. Then there are experts who provide interviews on various aspects of medical sciences. It could be medical ethics, medical litigation. Every doctor now who are going into surgery and stuff, right? They can always make a mistake. And this can lead you to serious litigation charges and stuff. So to know, a doctor must know the patient's right and his own rights too, like what should be done, what should not be done, about gender violation, or if there is a charges of molestation. Maybe sometimes an individual has made an honest mistake. He was not aware that if he would have avoided this, he would have not been charged with medical molestation, or molestation during medical practices and things like that. These are important aspects that one needs to learn. Sometimes to have a female attendant while you are operating or treating patients and stuff can save your nerve, because else sometimes if you are making intimate examination and stuff, and even if it is 100% medical, an individual may feel uncomfortable and stuff. So it is better to have an evidence, it is better to have an assistant, it is better to record and document them so that you do not land into problem. These were not problem 10, 15, 20, 30, 40 years back, but with new gadgets, secret ways of photographing, filming, blackmailing and all other kinds of challenges, a doctor needs to be very much aware of medical bullying, or medical harassment, medical litigation, forensic science related, medical ethics and stuff. All these are now very well laid out in many videos one can go through, and there is so much to learn. There is a whole world waiting there in how much to handle what situation, and what to do and what not to do is very important for any doctor, for part of the training, whether he's in Ayurveda, whether he's in allopathy, or any other branches of Ayush. Medical ethics is something that everyone needs to know, like what you can do and what you cannot do, what you can say and what you cannot say. These videos are making those things very lively for people to see and understand and appreciate what are the challenges that you face as a medical professional in this line. What should be your first response? How should you react? Where should you report? What should you document in case of these challenges and problems, including insurance related claims and stuff, and what you should not be doing under duress. Sometimes we respond in a different way under extreme pressure conditions and we make a mistake, particularly for medical doctors who are associated with complicated surgeries or even just basic treatment, any branches of medicine that they are practicing, conventional, non-conventional, Ayurveda, Siddha, homeopathy or allopathy. It is important to know your limits. it is important. For example, one of the very important thing that I have seen in some of these medical ethics video is saying that you have to be very professional. A doctor needs to be professional. If you look into the pain of your patient, and if it is impacting you emotionally, if you are falling in love with your patient, if you are getting too close, you are making contacts with your patient while under your treatment, and meeting his or him or her outside the hospital, you are spending hours that is not needed for the particular treatment, but you are still being part of that, is strongly medical ethics. As long as you are treating, you cannot influence the person. You should not be meeting them personally and stuff outside your chamber hours or your designated place and time. Because if you are doing that, whether it's a man or a woman, you are violating the rules of the medical ethics and stuff. You have to detach from the people that you are treating. You have to be able to know and learn how to deal with such delicate situations, very sensitive situations of dealing with a patient who is coming close in emotional touch with you or emotional relationship with you. It's a big, big no, no, no. I mean, still it happens in India without much repercussions. But in Western countries, if a doctor is found to have any kind of relationship that he has developed during the treatment, is considered very strong violation of your medical ethics. Your license could be suspended. Even if there is no physical relation, even if it is an emotional relation, you must not be meeting an individual outside. Once she has cured, she has no longer dependence on you. You are no longer the doctor-patient relationship. Definitely one could meet. The legal aspects of these are often what you call it, misregarded by many doctors here in your country. Say for example, you meet someone in a marriage and said, oh Dr. Saab, I am having this problem and that, what should I do, and things like that. You had your pad, you, without your investigation, by listening to the case history, just because you wrote a prescription, and that prescription, and she followed and resulted in some trouble. Then you are in deep trouble because you have provided prescription outside your jurisdiction, outside the area where you should not be working as a medical professional. You have not checked the medical reports and stuff, provided a prescription. Still, these are not so big problems for Indian doctors practicing in India. But this is coming, I can tell you. This is coming, and this is something that is not taught in the medical school very properly, because we are overloaded with so much curriculum and syllabus. But a modern doctor in any branch, allopathy, homeopathy, ayurveda, does not matter, they need to know these parameters, they need to know these limitations, they need to know the regulations. One has to be aware of various medical legal regulations that the government have introduced, what law have changed, what you can do, what you cannot do, what are your rights. One has to be very, very, very much aware of this, or else you are living in a fool's paradise. Because if we think that I'm a highly experienced, I'm never going to have a trouble, then that's overconfidence is one important factor that can make or break a medical doctor. So, so I would say such short films on various aspects of medical sciences, from the societal perspective, from the medical perspective, from the cultural perspective, it is very, very important for doctors to be associated, learning through the process, and get associated in better understanding how the medical system is working now. If you are traveling from India to another country and becoming a doctor there, you have to go through this rigorous training and stuff. Any mistakes and misinformation may result in huge lawsuits of millions of dollars. So one has to be very, very careful. And there is extremely good training down there. It is still not big deal, but I think for doctors it is important to learn through these systems and stuff, because when the day you are in trouble, there is no one to help you. So it is these things. I think the short films, the documentaries on medical sciences are having huge impacts, particularly if the doctors are spending time. I know that time is a huge factor in the life of a practicing medical. But if you can integrate this learning with your coordination, even when you are not even student, when you have completed, you are entering into your professional life, spend some time on the electronic media, spend some time on the social media to get some idea about these videos that are being provided in various aspects. It is going to enrich you. So I think overall, not just medical science, this has been a huge impact on all disciplines from science, technology, humanities, and social sciences, including medical and agricultural sciences. And it should be taken taken as an opportunity for doctors for better training them. You wanted to be a better doctor, you want to be a well-informed doctor, you want to be a all-rounder doctor, then it's definitely various short films made on medical sciences, particularly in the narrow super specialty that you are working, or even in a narrow area of that one particular medicinal plant that you are specializing and prescribing people. There are countless ways now to reach and enrich yourself just by the touch of your fingertips, just from your mobile phone or from your laptop. One should take advantage of these technology boosts and learn and enrich themselves. Thank you very much for the opportunity provided. It has been a pleasure once again to be on this platform. Thank you.
Thank you so much. What a wonderful presentation it was. At points, you mentioned so many minute things during the dissection to surgery. Even the smallest minute part should be taken proper care of. At the same time, you warn and alert at places for the practitioners, for the patient, practitioner, attending physicians relations, and also the social relations. These things are of great importance. At the same time, these can be put in a form of small, say, videos, so that it can be repeatedly be shown to the person concerned, and in that way, the legal points be saved, and the person who is attending the physician may not be meet with the hard time. So wonderful presentation with the good note that we should know our discipline, we should know our limitations, we should know the area for working, and also we should be honest and committed enough for the profession, for the job we have been given by the God, and that too which make us near to God. Of course, all the sectors are equally important to be aware with the help of the small movies. Thank you so much. And what Professor Point Sharma
Thank you very much, sir. Thank you very much, Sakat ji, Suparna ji, Adani, CP Sharma. कल हम लोगों की 3 वेबिनार है। पहली वेबिनार कवि सम्मेलन, दूसरी 9 बजे से हमारी ड्राई स्किन पर, और तीसरी सैकत सुपर्णा जी दोनों जो कहेंगे वो। थैंक यू वेरी मच ऑल। थैंक यू ऑल।
Most welcome, no problem.
जय हो।
Good night and take care.
गुड नाइट। थैंक यू। एक आप ही हैं पूरे स्पीकर में जो अपने टाइम की वैल्यू जानते हैं। ग्रेट, रियली सैकत जी, सुपर्णा जी, ग्रेट। थैंक यू।
Thank you. Take care.